Welcome everybody to Creation the Fertility Center. I am Dr. Trina Karmakar. I am an obstetrician and a gynecologist in Infertility Center, that is Creation. I am even an infertility specialist. I have been working here from past 3 years. Today I'll be talking about a very basic topic, that is why do couple actually face infertility. So approximately, if we see, approximately 20 to 25% of young as well as old couple, they come to me with infertility problem. So they are, as tagged as a infertile couple. So here we have to really see that who is having the main problem, as in if it's a male form infertility or it's a female infertility. So for that we have to further diagnose, as well as we have to treat the cause in order to see that how can we just actually overcome the whole of the problem and we can give the couple a healthy child. So for that we have to undergo a proper and a very rigid amount of panel of tests which can actually determine the real root cause of the problem. So whenever a couple is coming to me, we have to further evaluate, and now we will be tagging if a female is having a problem, so it is a female infertility. So whenever a female is having a problem, it is known as a female infertility. So during this phase we have to do few of the investigation for the female. Now whenever a female is having problem, there can be different kind of causes which causes the female infertility. That is, first of all, let us talk about the basic things, that is the uterus and your tubes and your ovaries. So when there is any problem in the uterus, when a female is having any problem with the uterus, that is the female is having any polyp or any fibroid or any problem with the irregularity of your periods, that means this is the uterine factor. If the female is having any kind of a problem with the tubes, that is if the tubes are blocked, that is we try to do few tests, and if we see that the tubes are not patent, that means it is unable to carry the egg as well as the sperm. So that causes the tubal factors. And if there is any ovarian factor, meaning if the patient is having any endometriosis or any cyst in the ovary or any PCOD kind of problems, that means it is termed as a ovarian factor. Now there is a very important thing, that is the hormonal factor. Now hormonal factor is a cause which causes most of the problems during your adolescent period to your later half of your marital life. So now what happens is during this hormonal period, that is one of the cause of PCOD. Now when a person is when a female is actually suffering from PCOD, there is a lot of problem, meaning there is irregularity in the periods, there is a rapid amount of weight gain, there is a stress factor, there is a lot of hair growth all over the body. If such kind of a problem is there, if there is a lot of acne or anything as such, so that kind of leads into a problem known as PCOD, that is a polycystic ovarian disease. Now if a female is having such kind of a problem, we have to rectify the hormones. Now other hormones also plays a very important factor, that is a thyroid stimulating hormone, as well as your prolactin. So these are the other hormones that really causes a lot of problem in the reproduction. There can be a problem regarding the ovulation of the patient. Ovulation meaning the rupture of the egg. So if there is no ovulation of a patient, that means that can actually lead into a infertility. Other causes might be the excessive amount of weight gain, that is obesity, excessive eating disorder, that is anorexia nervosa, as in if a person does not really, there's a rapid decrease in the weight of a person, even that causes a lot of problem. A lot of stress in women is also found to cause a lot of problem in the infertility sector.